back to the chair so that we can launch into panel.
Thank you, Sumantra, and I hope you could see the applause there. It's fantastic. Can I ask all of the speakers to come back up on stage, please? And Sumantra will be with us live, remote, so I don't think there's a time lag there, Sumantra, so bear with us if there is. Right, thank you. Actually, dozens of questions, so I'll try and get through as many as I can, and if I may, I'll probably abridge a couple of them because some of them are on a very similar theme. I think I'll start with, let's just start with the order that the speakers came up. Jonathan, as punishment taxes and sin taxes, whatever we decide to call them, as punishment taxes affect the poor more as a proportion of their income, won't this just result in poorer health outcomes from this level, this population that is not already engaging with the National Health Service?
So that is a very good question. I think sort of alludes to, I'd go so far as to say myths within the policy discourse around this. I think one of the themes that cut across all of the presentations is that nothing here is simple or straightforward. It's multifaceted. Bunging a tax on Mars bars will not help. But thinking about how you implement a tax in a way that incentivizes healthier choices, changes food environments, and cuts across a range of levers that shape our health, that will be an effective way, and if it is done correctly, it shouldn't have a damaging impact on income or on expenditure. We want to be looking more at that end of the spectrum where companies are being incentivized to reformulate food and to improve food environments via that mechanism. Increasing the cost of food, particularly at a time of massive inflationary pressures, would not be a good approach. That would be unfair and damaging. But there are ways of doing this where you just reshape food environments, you incentivize choices, you don't penalize a person.
Okay, thank you very much. Christopher, I'm pulling several questions together actually. Given that clearly governments change and therefore food policy changes and preferences changes, when you have something like your statements from the current government around levelling up, and specifically with a view to levelling up the north, which clearly, as Jonathan has shown, has poorer health outcomes, how can we actually make any assessment about taxes whatsoever on food when there is constant chopping and changing of that policy? Do we need something over a 20, 30, 40-year period to actually make any meaningful decisions around food taxes?
No, I mean, that would be tying the hands of future parliaments, which would be undemocratic. I mean, you know, we've had 4 prime ministers in the last 7 years. They've all been different characters, and they've finally ended up with one who's more of a sort of Thatcherite free marketeer. And if people don't like her, they'll get rid of her and somebody else will come in with different views. But she's made her views very clear over a period of many years with regards to the nanny state. She's not in favour of it. She's been very outspoken about it. And that is a perfectly reasonable political position to have. With regards to levelling up, you know, levelling up is an economic agenda. It's not about, you know, trying to impose the lifestyles of Southerners on Northerners or anything like that. And a lot of the chat about health inequalities, when you look at it in relation to lifestyle, it boils down to imposing the lifestyles of middle-class people onto working-class people, to put it bluntly. So that's not what levelling up is about. Levelling up is about getting the economy of the north of England in particular, and parts of the Midlands, up to speed and sharing the growth. It's not about taxing people who drink sugary drinks or consume ultra-processed food.
Okay, thank you. That's great. Tim, a slight... Oh, my questions have gone. Can somebody pull these back up for me? What have I hit here? I promise I didn't touch it. It's just gone to the blue screen. That's my famous words with text. I promise I didn't, with tech, I promise I didn't.
Can I just make a comment while you're thinking of the question?
Sure,
about the previous. I just wonder if cigarettes were on 2-for-1 specials in every supermarket at the counter, do you think the government would encourage that? Or would if there had been a law to say, okay, we're going to ban 2-for-1s cigarettes, or whiskey maybe, do you think the nanny state would balk at that? Because my view on this is that it's a question of level. Until we get ultra-processed food seen in the same way as alcohol or as cigarettes, sort of where we were, perhaps in the 1970s, we're not going to make much progress on this political area. I just think that's a useful analogy to make, because to allow poor people to eat more unhealthy food and get fatter doesn't seem to be particularly egalitarian.
Well, see, can I just come back quickly on that? I mean, I don't think it's a helpful analogy to make at all. Because if you go back to my initial slide showing all the things that need to go right for sugar taxes to work, if you do a similar slide for cigarettes, it's really very simple. The less smoking there is in society, the less lung cancer there is, and therefore if you increase the price of cigarettes, leaving aside the possible impact on the black market, you're going to see fewer smokers and you're going to see less lung cancer. With food and nutrition in general, as your presentation showed very well actually, it's much more complex and the science is much less certain. And I'm very interested to hear what you're saying about the gut and so on. I have no idea how mainstream that view is. I don't know whether you're right or wrong. What I do know, as a layman looking at this with some interest but no expertise, is that the science always seems to be up for grabs and it's always changing. And now you're saying artificial sweeteners are no good and calorie is not a calorie. And I'm sure we could find people who have exactly the opposite view, or think that the whole problem is sugar, or the whole problem is carbs, or the whole problem is fat. Whereas with smoking, it was established very clearly by the time we started regulating the tobacco market that it was very bad for you and there was no real upside to smoking. With nutrition, we are dealing with science that constantly seems to be changing. We don't really know what the impact of encouraging people to consume artificial sweeteners is, or to reduce their salt intake. There's all sorts of dynamic effects in a market which is fundamentally different to tobacco in many ways, but one of the most important ways is that you don't need to smoke, but you do need to eat food. So I don't think it's a helpful analogy, because in 10 years' time, people could be saying something completely different, and maybe we'll be subsidizing sugar or something, So when we don't actually know what the issue is, and no one has really given a compelling explanation of how obesity has risen so much over the course of the last 50 years, aside from anything else. It's nowhere near as simple as smoking.
I disagree totally, but we may want to go back. I think you've just given Big Food playbook. That's exactly it. Let's keep people confused. It's too confusing. It's too complicated. We'll never get around it. But how anyone could say a giant bag of Doritos is healthy.
Your book is called Everything We Think We Know About Food is Wrong, and you're telling me there's no controversy here.
No, I'm sure there's people who disagree, but I think that's not the future.
Whilst I'm tempted to let the discussion go on, actually, but we've got lots of questions to get through, so points taken, and people can follow up with you later after if they want to have a quick chat. Tim, one for you. This is a very long question, actually, so I'm going to only go halfway through it, and I hope it doesn't affect the impact of the question. A slight challenge, actually. Tim, how can you say there is no benefit from switching sugary drinks to sweeteners when dozens of RTCs show that making the switch improves weight, body fat composition, glucose tolerance, blood lipids, blood pressure, and so on?
I'd say look at those studies again. Look at the meta-analyses done by independent groups. They don't see those results. So a lot of the early studies were done on very small numbers, sponsored by the artificial sweetener companies, etc., to show there were benefits. But the longer time's gone on, the more negative studies have come in, showing not only that artificial sweeteners against controls show metabolic disadvantages, but lack of any significant overall results when you compare it sugar versus artificial sweetener. So I think it's a question of which meta-analysis you're going to believe. But what is interesting is it should be absolutely barn door. You shouldn't need meta-analyses of complicated ones to show that if you switch people drinking 2 cans of Coke to 2 cans of Diet Coke, according to all the sort of previous rationale, they should be losing weight, getting less diabetes and having less health problems, and that's absolutely not the case. So, I dispute that and re-look at that literature.
Thank you. Okay. Sumantra, you've got your hand up? Yes.
Hi there. Sorry, could I just make a comment? I'm really missing the heated atmosphere in the room, but nonetheless, what I would say is that I think, like any cognate scientific discipline, and I'm trained in metabolic medicine as well as public health on the medical side, so as we discover new truths, we need to let go of older assumptions, and nutrition is no different. I think perhaps what is different is that if you compare with medical science and pharmacology, of course, not everyone has to medicate, and therefore knowledge is very specialized, very regulated. But of course, as someone said, everyone has to eat, so everyone has an opinion on food, and this is why there are some systematic changes in the science and our understanding of how that ought to be implemented. But I think what is also out there is a lot of noise and a lot of information, and so it's quite important for policies and guidelines to rise above that, and for health professionals, therefore, to be evidence-informed and keep up with those changes in the evidence base, and not just stick to old assumptions, but do so knowing that there is method in that madness and it is underpinned by sound scientific method, but also be able to critique that scientific method where needed. But I think, theory aside, what I would say is that from studies that we've done, longitudinal studies that we've done in the British population, for one, dietary patterns have been a very useful way to look at the proportions of the population who are exposed to different types of foods and foodstuffs, whether those are ultra-processed foods or indeed other things. And there are cut points, particularly for healthy, free-living individuals, where we begin to see beyond a certain threshold the emergence of pathology or disease. So knowing where those lie, and actually being able to apply those to policy and practice is really the challenge before us. And I think meetings like this are an excellent opportunity to start joining those dots.
Some applause there, so I hope you're hearing that. Actually, I'll come to you now, Sumantra, if I could. And again, a couple of people have asked a similar sort of question. So beyond taxing, is there any evidence that giving subsidies to to industries that produce healthy foods will have a reverse effect to taxing unhealthy foods?
There is some evidence from action research models, which, in fact, and we are involved in a piece of research that is looking at this across 3 countries, and the UK is not one of them yet, but is likely to be added to the mix next year, where, in fact, giving subsidies to individuals to actually run nutrition and health sensitive micro-enterprise. So this is really the production, preparation, and then sales of index foodstuffs or meals that allow a conversation around healthy dietary patterns. So this shows not only an impact on members of the public, which is quantitative, which can be quantitatively measured, but it also shows that this is economically something that can be self-sustaining, because we've been surprised in the countries where this model has been run that actually this is something that has had great reception from different levels of society. So I can't say too much at the moment because we're on the threshold of actually adapting and implementing this model in the UK, most likely next year. But when we reach that moment, I will be able to answer your question more definitively in a UK context.
Okay, thank you. Again, this is a question, there are probably 4 or 5 questions that allude to this, Jonathan. Who's funding the research that is coming to the conclusion that taxes don't necessarily impact on the consumption of sugar? Is there a common thread or is it multiple sources?
I would imagine there are multiple sources, and there are, I'm sure, a range of organisations who have funded multiple research projects. I think we need to be very careful here about getting into the realm of conspiracy theory here, but there is a role of industry within this. It is also a highly politicised space as well. I think that has gotten in the way of progress and kind of cutting through a lot of the noise, trying to kind of work out why we've got this sort of critical, ever-rising and unfairly distributed level of obesity and ill health is the priority here. Kind of what we fundamentally know that cuts across all of this is that being poor is really bad for your health. It limits the choices that you can make and the health and life expectancy that you will have. So we all have a commitment here to try and sort of focus on what matters, try and cut through a lot of the noise, and sort of return back to kind of what we're here for, kind of why we get out of bed in the morning, and it's trying to improve health, improve lives. So I think it's a focus on that, and not to get drawn too much into the conspiracy points.
Okay.
I mean, there are a lot of reviews I came across that are sponsored by the food industry to address some of these issues and some of the issues on artificial sweeteners. And the question we had earlier about, isn't it true that actually there's no evidence? You know, you can always find some reviews out there. There's many more reviews than studies. And you'll find that many of those reviews are ultimately paid for by the food and drink industry, in my opinion, to muddy the waters and keep the debate going when clearly we should have moved on. So I do think we need to be very careful about reviews, where they come from. It seems some strange research company that's been set up to do it, not real academics, and often they're paid for purely as like a commercial idea. And I think the same as I came across a few like that, talking about sugar taxes and things like this, that just there is a lot of muddy waters, I think is what you're saying, but just be careful who's muddying the waters. Yeah, sure.
Okay, again, several versions of this question. So if I could, I'll go to Tim first, and then Sumantra, if you could come in after Tim. So here I am, about to pull the pin and run away. Tim, what are your thoughts on the rise of veganism / plant-based diets, and whether this is beneficial or detrimental to gut health?
Great question. Well, plant-based diets are definitely the future for a healthy planet and healthy humans. So eating more plants, more diversity of plants is good. Whether we will have to be vegans to do that is less clear. And what's true from our research is that there are lots of different types of vegans, and there are healthy vegans as well as unhealthy vegans. And so I think we should stop trying to label people in these boxes. And we found when we did a survey with the British and American gut projects that there was no difference between the average vegan's gut health and the average person who ate a variety of plants and had meat from fish and dairy episodically. So you don't have to be exclusively meat and dairy free to be healthy. And there were 10% of vegans who were actually less healthy than average because they were eating ultra-processed foods, lots of dairy replacements, lots of cupcakes, usually gluten-free. So I think in general, the more plants we eat, the more diversity of plants is definitely good for our health, our gut health, and we still think that this magic number of 30 plants a week, which includes herbs and spices, nuts, seeds, etc., something around that level is what we should be aiming for. Many of those things mean that it's going to be good for nitrogen and our carbon footprints and using less land and only occasionally having meats. But I don't think we have to be exclusively vegetarian or vegan, but we should be majority in that.
Sumantra?
So I'm currently sitting in a country of probably 500 million vegetarians, very few of whom are vegan. So I suspect, without any evidence, to be honest, that if those people were to switch to veganism from vegetarianism, that would be quite alien, not just socioculturally, but also to their physiology and possibly to their gut microbiome. But that anecdote aside, I completely agree that the more plant-centric we are, it's likely that we will not only be getting the nutrients that we need, but the dietary bioactives such as polyphenols and essentially other phytochemicals which could have a positive impact on body systems, health, and so on. And there's a vast array of evidence now that, and of course Professor Spector will be very much in the know on all of this, but there's a vast array of evidence that a lot of the dietary bioactives and polyphenols that we eat in our diet, they are processed through the gut microbiota into secondary metabolites that then have an impact on our body systems. So certainly we don't know enough about that in terms of dose-response relationships and how that should be systematized to population recommendations. But the good news is that earlier this year at the International Conference on Polyphenols and Health, we were given the task of bringing together a consensus publication on where we're at in terms of polyphenols, dietary guidelines, and public health. So watch that space. Going back to veganism itself, I agree that labels are unhelpful, and sometimes in the vegan sections of supermarkets, you will find highly ultra-processed foods which contain a variety of meat substitutes, and I read the labels quite carefully and often cannot figure out exactly where those materials come from. And generally, I think it may not be a great idea to introduce things into the body system which we're not physiologically built to process.
Great, thank you. Can I ask the tech guys to pull up the poll slide, please? I do apologize, I forgot to bring that up earlier on. If you could have the question, if I could ask you to keep voting on that while I go to Christopher for the last question, and then we'll see where we are at the end of this, which is actually very close, interesting, very close. Christopher, you referred to the Mexico study where I think you said they could demonstrate a 12% reduction in sugar consumption as a result of the tax. And there's some evidence or some suggestion potentially that in Scotland there's a reduction in alcohol consumption as a result of the minimum unit price. But do we know in which part of society that reduction is taking place? Is it the worried well that already know about the health benefits of reducing alcohol? And the target audience, perhaps, as we've all discussed previously, are actually not reducing their alcohol consumption or their sugar consumption?
It's a good question. In the case of minimum pricing, which I've done quite a lot of work on, is exactly that. Yeah, the heaviest drinkers are not cutting down their consumption. There's been a fairly modest reduction in alcohol consumption, about 3 or 4%, since minimum pricing came in 2018. And there's a study only came out, I think, 2 months ago, showing that this is mainly among women who weren't drinking very much to start with. Among the heaviest 5% of male drinkers, they're actually drinking more. They're going to the pub less, but they're buying more alcohol from the off-trade. With the sugar tax, I seem to recall with that particular study by Popkin, bearing in mind it was very much based on his counterfactual of what he thought might happen. But I think he said that the most deprived groups there was a bigger drop in consumption than amongst the rich groups, which I guess you might expect. It didn't, however, look at the heaviest consumers versus the lightest consumers. Typically, with these kind of products, you see more an effect on the worried well than you do on the people who really consume a lot of it.
Yeah. Okay. Guys, can we have the slide back up, the poll, just see where we are with that? Because we're out of time now. We're going to wrap up. And that's I mean, I don't know what you feel. It's a very blunt question, but I don't know what you all feel about that poll. I think that's a lot closer than I had anticipated, actually.
It's a lot better than I expected, yeah.
In which sense better?
Well, I'm not far off winning.
Okay, well, bang on 12:30. I'm going to ask you to thank all our speakers again, and then it's downstairs, directly below us for lunch. Thank you.